Should your child get the COVID vaccine?
If children receive the COVID vaccine, they are less likely to get COVID, which is great. That means they're less likely to get sick. A thought at the beginning of the pandemic that maybe children weren't as affected by COVID and weren't getting infected as much as adults. But what we know, especially during the Delta variant that happened over the summer, was that children actually were getting sick with COVID. And much like adults, children can have long COVID. They can also have something called MIS-C, which is the multi-system inflammatory response that can happen after a COVID infection in our older children and adolescents. And that can be very serious and require pediatric intensive care admission. There are effects on the heart that can happen during that syndrome specifically. And so the idea that COVID doesn't affect children seriously or affect them long term is not true, unfortunately, as we've seen play out with this pandemic.
Visit sfmc.net/COVID-19